It was late December when Chinese authorities sent an initial report of a pneumonia-like illness to the World Health Organization. Well, in mid-January, the world began to see the coronavirus go beyond Chinese borders. And by the end of February, the virus claimed the first American life. The global COVID-19 outbreak has been making an impact for just under 3 months now. In tonight's Eye on Kettleland, Lauren Solik introduces you to two people with South Dakota ties who are living abroad during this pandemic.
South Korea has over 8,000 confirmed cases of the novel coronavirus.
February is when Daegu got hit by the super spreader, and that had gone to one of the churches in Korea, and then it just basically from there spread like wildfire.
Tatum Dean, a Mitchell, South Dakota native and USD graduate, is teaching English in a city that at one point was number 2 for the most positive cases in South Korea.
At one point it was like we were getting almost 10 or more cases a day, and now it's like there might be 2 new cases. So we're being mindful of it, but it's not, it's slowing down now.
As schools in South Dakota begin their first week of closures to avoid the spread of COVID-19, Dean is on her 4th week of non-traditional teaching for her students.
I've had to do live classes or recording videos of our classes for our students.
Over 5,000 miles away, Talita Fantauzi, a USD graduate, is at law school in Nottingham in the United Kingdom, where residents are in the beginning stages of seeing COVID-19.
Some universities are transitioning to online classes. The University of Nottingham, for example, a few of my friends go there, and they're transitioning, I think, in a couple weeks.
However, Fantauzi spent most of her life in Italy, where her parents still live. Italy is currently ranked 2nd on the list of confirmed cases.
You can't even leave your house without a paper that you have to fill out. I don't know exactly the details, but you have to fill out a form to explain where you're going, why you're leaving your house.
Though both Dean and Fantauzi are healthy, that doesn't mean they don't have worries.
What's scary is that even if you're young and you say that if you get it, nothing's going to happen to you, you might pass it on to someone who doesn't have as strong of an immune system, and they might die from it. So I think that people need to think about that more than just saying, I'll be fine, I'll just keep going out.
I am in a foreign country where I'm not fluent in the language, and my family is, 6,000 miles away. But as time went on and everyone else was kind of living their lives, I was kind of just now I'm a bit less, I think, afraid of it.
Dean and Fantauzi offer advice on what people in the United States can be doing.
If you're younger and you have a good immune system, then don't worry about it more than you should. Rely more on sources like the Center for Disease Control and other official government sources as what to do and how much to worry. Don't, go on Instagram or Twitter to get your sources on how bad things are and what precautions you should take, because anyone can write anything on those things. So be positive, be hopeful, look out for messages from official government and just trusted sources.
It's good that people are being informed of what this virus is and how you can stay safe and things like that, because there probably are countries where it's not really talked about, and so people are going out through their lives and they're not realizing how dangerous this can actually be.
With Eye on Kettleland, I'm Lauren Solik.
Both Dean and Fantauzi explained how the healthcare systems in their countries have responded to the outbreak. You can find those additional quotes under this story on kettleland.com on our website, or you can also find a timeline of the COVID-19 outbreak.